Hello, Damilola. Hello, good afternoon. I will I'll give 5 extra minutes before we start for others to join. Maybe they're facing some technical issues. So I don't know if you can hear me. Can you hear me? Uh, if you can hear me, you can just react or mute and say you can hear me. All right. Thank you. Thank you, Dan. So we'll wait extra minute. Please call the attention of your classmates to join. Thank you. Okay, I think we can start, right? Other people can join in the middle. We'll see how much attendance we will have. Uh, you can hear me, right? Can you hear me? Okay, thank you, Evangelina. So, yeah, I will be taking us this important aspect of history of pharmacy, and by history of pharmacy, not just history of pharmacy in Nigeria, globally, how it evolved, how it started, how it come to place, uh, from evolution of human beings to the stage where we are, uh, how development of the profession of pharmacy uh, come to stay. This is part of your uh, PCP 102 lecture. I will be taking these aspects. And another important aspect will be new drug development, which we will be taking next week. It is very important to understand the history of what you are studying because it will give you an idea of where you have been and the type of developments you have with years and where you are at the moment, and probably will even give you an idea of where you are heading to as you study pharmacy because things are evolving very fast. Science is moving, science and technology are evolving very fast. So it's very important to understand where we've been. From ancient time, evolution of pharmacy, you know, man have several characteristics on how to treat ailments, both physical, mental, and spiritual. It is very common. Man was created, man must be infected, must be have ailments, we must have diseases, outbreak, even as since the invention of human being. Definitely, man is programmed to look for solution for all the problems they're having, and therefore, man have been observing the environment to make sure they look for a solution to the ailments which they have, diseases, either human-born, animal-born, airborne, all kinds of diseases happen. And sometimes could be accidents. Nevertheless, whatever the case may be, a solution must be sought by human being from the evolution of humans. So based on evidences available, there will always be search for treatment for conditions, like I said. And pharmacy has been the art which humans use. And later on, it actually graduated from art to science. We know what science is. It's a step-by-step studies. So now pharmacy is regarded as a science, still with a touch of art, but majorly regarded as a science of drug discovery, not just discovery, how to use the drug, how drugs are being used to treat humans, how they are being used to prevent infection, not just treat, also prevent in recent sciences. So let me just put a slideshow. This is better, right? I want you to understand two key points. Mankind observed and found their medication through two processes, observation as well as trial and error. A man from the ancient time observed birds, you know, leaves, use leaves, dirt and mud to apply on wounds they actually got or infections they got to treat those infections. So through careful observation, if you look at all our discoveries now, whether they are cars, whether they're drugs, we actually, human beings are very intelligent. So we actually come across our innovations from our surroundings, from what we see. Uh, If it is aeroplane, it comes from observation of how the birds fly. You know, cars come from observation of wild animals, even the design and how they will move faster, how they will light. So be it in the drug aspect, in the pharmacy aspect, through observations of how animals treat themselves, how they come about. That is how human beings compiled evidence and come up with some of the drugs. Other ways are through trial and error. Somebody has an infection, I'll just cut these leaves, mix with these leaves, apply on the place, observe, or maybe evaporate and, let them drink or inhale it. Eventually, human beings applied all this knowledge for the benefit of themselves and for the benefit of uh, their environment, thereby discovering many medications. But let me tell you something. These discoveries did not just stop there. Discoveries are being documented, and one of the oldest documented uh, medicine is the Egyptian medicine. Because let me tell you this, it should be clear. Before, there was nothing like medicine, pharmacy, physiotherapy, medical lab. One person does all this work. They diagnose, they clerk the patient, they find the drug, they administer the drug, they observe the patient, all the processes done within the hospitals are done by one individual person. It was later, after evolution of science, we had all this division, all these pharmacists who specialize only on the drug. And then we have a surgeon who does the surgery. We have a surgeon for eye. We have a surgeon for GITs and other parts of the body. So you can see science evolves, but initially one person oversees all aspects of medication. So if you go back to history of medicine, go back to history of pharmacy, you realize that the beginning is all the same. Egyptian medicine is the oldest form of medicine, 2900 BC. If we know what 2900 BC is, 2900 BC is 2900 years before Christ. So that's a long, long time ago. And we had this papyrus era, a collection of 800 prescriptions, mention of 800 drugs from from the Egyptian medicine. So you can see they had a method of storing these drugs. Also, there were instructions on the bottles they used to store these drugs or the containers. Also, there are priests called the Synod, uh, who are held by Wammer. You can see it there. Papyrus are written in the 20th century BC, reported about 2,000 prescriptions, many of which are drugs from plant, animal, and mineral origins. So they had, it was reported the papyrus errors in the ancient Egypt used to have preparation, prepare dosage forms such as mixture, tablets, lozenges. So you can see it's not new. It didn't start now. It evolved. It started long time ago and then evolved gradually over the years into what we have now. So you can see there were special schools where they actually uh, cascade this knowledge of what they have tried on humans and they have worked. What have not worked will be discarded and not be tried again for safety issue, through crushing, maceration, boiling, filtering these herbs and medication, and then using the extracts, to treat people, and also schools, special schools known as House of Life were actually related to temples of uh, Una, Sais, and other main cities. So basically, this is explaining the science of discoveries and teaching. These are some of the uh, prescriptions, scripts, the papyrus tables. They are well documented. And how the documentation is done is how the drugs are being prescribed, discovered, what they treat, the ailment they treat, and also, most importantly, the doses, how much quantity is required by a human being, whether it's an adult or younger. So these are scripts that documented all those details required. Uh, Example of drugs, you can see them. The castor oil from the castor trees, onions, figs, and we all plant from drugs from plant origin, like I mentioned earlier. These are some of them. And then drugs from animal origin, like honey, from the bees, right? And we have the fats, beeswax, uh, milk from donkeys, liver. All these were used as medications, are still being used as medication. And we have drugs from mineral origins, such as the alum, the copper, uh, are being used. Still, we use all of these medications. So they were actually discovered by somebody, and we are still benefiting from that. Another, uh, what I will call school or history of pharmacy is the pharmacy in the ancient Babylonia. Babylonia is in Iraq currently. It's second oldest history documented for medicine and pharmacy, back 2600 BC. So you can see how close it is with the Egyptian medicine, which is regarded as the oldest. Pharmacy, the ancient Babylonia, you can see uh, the practitioners of healing era were priests, pharmacy, physician, as I told you earlier. These are respected people in the community. They are priests, they are pharmacists, and they are physicians all in one. Just one person is doing all the work. So you can see there's a component of spiritual healing, a component of drug healing, and there's a component of surgery and every other procedures that are being conducted, all done by one man. There's a very there's very much composition of spirituality in the Babylonian medicine. The god of medicine was called Ninazu. He has a son where they symbolize two snakes. If you see the symbol of medicine and pharmacy with the two snakes wrapped in one stick, is actually originated from the Babylonia. This stick symbolizes punishment from gods by being sick. Healing was considered as purifications from sin. We have the Chinese medicine also dating back 2000 BC, the, the Asian China medicine. So this, we have the Shenlong, who is regarded as the father of Chinese medicine, the emperor. He investigated a lot of medicines in the Chinese medicine. Chinese medicine is a very old and still functional system of medicine. You go to China, they still practice it full time, study it, document a lot of medications, and it's still being one of the strongest traditional medicine that is being practiced up to date. You see, in the ancient China, a lot of people, by native Chinese, they actually worship, still worship by native Chinese drug guides as their patrons of gods. That is to show you the level of respect these people have, to the extent that some people are, even going to the extent of worshiping them back in the days. They treat herbs by soaking, boiling, just like the Babylonian Egyptian, same with method of extraction. Uh, so another important aspect is the pharmacy. in the times of the Greeks and the Romans. Greeks benefited much from the pharaohs. You know, I told you pharaohs documented a lot of medications and prescription. So that is why it's important. Everything you discover or find out, just document it, keep it, make sure you have it for the learning of others and for the continuation of knowledge. So all those fathers of medicines you've been hearing, Galen, uh, and we'll come across them in the next slide. You realize the Dawsons, James Gray, a lot of them uh, had a good learning from well documented medications and prescriptions from the Egyptian era. We have the School of Alexandria. It was established in 300 BC. You know, it is the first for teaching different subjects, including medicine, pharmacy. From documented sources that are going over 2,000 BCs. Several scientists actually graduated from there. We have the Galen, uh, is a physician and a pharmacist from the Roman Empire. And we know about the Hippocrates, 460 BC. He was the best physician known in the history, recent history of our time, documented. Uh, he was born in Greece when medicine was governed by superstitions and magic. Uh, placed medicine in scientific frame based on logic interpretation of clinical observation and examination of patients. He also describes accurately several diseases such as tuberculosis, eclampsia, epilepsy. So these are the contributions of people who went to School of Greeks. That is when medicine and pharmacy started to be uh, taught in schools using the previously documented evidences and documented medications and prescriptions from the ancient time. So as I told you, it was evolving and gradually it became a science. So this is how things gradually started evolving. So you can see these are some of the scientists in the pictures. I will share the notes with you. You will read them carefully and have a better understanding. So back to Nigeria. It's very important for us to understand the evolution of pharmacy in Nigeria from traditional medicine, which we have started with, to the model which we are having now. The documented history that we have, not very rich, but yet very significant for us to understand the key milestone, the regulation, education, as well as professional developments that we have. It is documented pre-colonial, early colonial era, and also post-colonial era, for us to understand how the practice evolved. Pre-colonial era, mostly people were being treated by traditional healers, herbalists. We still have them. Initially, they were the only people not regulating, but treating people and getting the success. Mostly driven by spiritual belief and religious belief. They have used indigenous herbs and medicines that are being mostly given orally, grinders, macerated, giving to people. So we all know this, we see this in the movies, we see this physically in our surrounding, they still exist. So it's just for us to understand that pre-colonial era, these are majorly the people that have been treating
all the elements and conditions. While in the agricultural era, they were a mix of the two, even though we had the herbalists and the traditional and spiritual healers. That's in the 1850s to 1900. European missionaries and traders introduced medicines, some of which the quinine, the morphine, which we use mostly as analgesics and treatment of other infections. There were no formal pharmacy practice medicine then, but then in the post emergence of the post or just during the colonial era, in 1900, the British administration started by its medicine services in Nigeria. And the amalgamation happened in 1914, where we had some organized hospital services and drug supply structure, even though not a lot, the few were, were able to serve the population in the country we had. And training, small trainings of compounders begin in the 1950s to 20s. 1927, we had a first pharmacy for poison ordinance. And then 1930, board for examination of chemists and drugs were established. The profession began to grow in the 1930s to 1960, that is the independence. In 1932, there was a creation of Pharmacy Board of Nigeria for overseeing the regulation of practice of pharmacy. In the 1940s, the first Nigerian trained pharmacists, we had a first Nigerian trained pharmacists. Mostly they were trained in the UK, not in Nigeria, because we didn't have an institute that was so Pharmaceutical Society was for Nigeria was established in the 1957. And then we had expansion of hospital pharmacies across the region. Now, post-independence expansion, where the development happened extensively in 1962, first locally pharmacy schools, University of Ife, and then we have in the 1965 ABU Zaria started pharmacy education. Drug Control Division was established in 1972. 1978, Pharmacists Council of Nigeria was created, and therefore regulations got strengthened. Growth in the health facility and pharmaceutical workforce got strengthened. Regulatory reforms and modernization happened in 1980s to 2000. Regulatory and industrial reforms that happened in 1980s to 2000 includes rise of local manufacturing companies such as Enzo, Fitson, May and Baker. These are critical global pharmaceutical companies because the market is evolving, the education is there, institutions are there for regulation. They started establishing companies within the countries that will produce drug and also provide services to the teeming population. NAFDAC was created after we all learn from mistakes. Sometimes we, as humans, that's where we are. NAFDAC was created after a toxic syrup incident. And in 1992, we have the National Drug Policy, which was launched for essential medicine regional drug use. We also have stronger drug registration, surveillance, as well as quality control system. Now, the developments proposed in 2000 to the present years we are. There was further expansion of pharmacy schools nationwide. And also we have the pharmacy, we have the National Pharmacovigilance Center, which was established in 2006. And then there are a lot of transition from B farm to farm D, more of clinically inclined and more clinically trained pharmacists. And also there are tools and softwares and digital development for surveillance and supply chain, as well as telepharmacy, of course. Uh, Somebody's mic unmuted. You can mute yourself, please.
Yeah. Sorry, sir. We cannot hear you clearly, sir.
Or since when?
Like 5 minutes now. Like the mic is somehow.
Is it just you or everyone?
Yeah, not just me.
Oh, okay. I'm sorry about that. So at what point did you miss me so that I can go back?
No, the thing is, like, I'm not really hearing you clearly.
He's breaking. The talk is not clear.
I think it should be the network, right?
And some of us cannot connect. So
Some of us cannot connect.
No problem. For those that cannot connect, I think we'll share the recorded lecture for everyone to later on come back to. And also I'll share the notes with your class rep with you, right?
Sir, we can't hear you.
Oh, God. So can you hear me now?
No, sir.
No, it's still breaking. It's still breaking. Not still clear.
Okay, just hold on. Let me change.
Now this white one.
Hello? Hello, can you hear me now?
Sir, it's still the same thing. It's breaking. Your voice is cracking, sir.
Hello?
So I said the same thing.
Still listening.
Sorry, huh?
Okay. Hello? Hello, can you hear me?
So we can manage this, but I would like to see the same thing.
It's still breaking.
Sir, we cannot hear
We
you.
can't really
It's
no,
breaking and it's
but
not making your
let's
voice clear, sir.
let's
So it's not giving us the real
let's
definition of what we want, sir.
Some of us cannot connect.
let's okay, fine. I'll share the video. Let's manage this for now. When I share the video, you have a better understanding. I'll sort out and then I'll share the video with the class. Okay, let's be patient, please. Another key area which the class should understand is
The various discipline as related to pharmacy
It's
profession
better like this.
in Nigeria.
it's
Okay,
better
thank
now.
you.
Better now.
So key disciplines and key professions where a pharmacist will work with after graduation, or uh, key areas that I will say are very important and key areas of practice for pharmacy. The first one is the clinical pharmacy. This has been the first because what we offer now mostly is PharmD. Uh, this relates to direct patient care, medication therapy, and as well as medication management and optimization of treatment outcomes. It's very important to know that the key role of pharmacists is safety of the patients, beyond just treating the patient, making sure what is given to the patient is the right dose and the right direction, and also at the right time to have the desired goal that is being required for the medication. So it's your role as a pharmacist to work as a clinician to ensure medications are given in the right way, they're stored in the right way, and also they're being transported in a pharma grade way, that is in a standard way of transporting medication and moving medication from unit to unit and ensuring you follow up with all inpatients and outpatients to ensure they're taking the right medication, the right time, the right dose. And also, there's no issue of mixing medications and, uh, incompatibility. Another key area is hospital pharmacy. Management of medicine, dispensing, procurement, patient counseling in the hospital. This is different from clinical pharmacy because clinical pharmacy can happen anywhere. It could be in a primary health care, it could be in a setting where your services are being required. But for hospital pharmacy, the key aspect is management of medicine. Like I said, the supply chain, as well as the procurement and the dispenser. Now we have the community pharmacies where majorly the key manager of this is the pharmacy. These are the pharmacies we see in our various communities. We call them sometimes chemists, that's lower level. Then the pharmacies, which are being highly regulated by the Pharmacy Council. All these are professions and areas where pharmacists can practice after getting the pharmacy knowledge. And community medicine is actually basically provision of medicines as well as health education. And also one key thing is immunization and public health services because pharmacy is evolving. Initially, you only have to go to hospitals to get immunization, to get other public health commodities like HIV commodities, free malaria services, free tea services. So now the profession is evolving. When you open your pharmacy, you can actually register your pharmacy with the government public health services, and you get to have access to free medications, which you give patients, free preventive services, which you provide to the community, And through this, you're actually doing what we call demand creation. People are coming for those free services, and then you're having access to more people. You're getting to treat them more. You're getting to screen them more for other infection, and you're getting to sell to them and also offer them more services. So this is a key area, greatly untapped. The community pharmacy is one area that remains greatly untapped by the pharmacists. Is one very important critical area. And then we have the pharmaceutical research, where new drug discoveries are being done. You know, at larger scale, we have a lot of grants by the big pharma industries where they fund new drug discoveries. If we can remember during the COVID-19, you know, there was an emergency to ensure new drugs are being discovered. If not discovered, the old drugs are being repurposed for use for the COVID-19. And also, as we speak, several other drugs are going through clinical trial and processes of being discovered. And they will hit the market. If we can remember initially, our drug lists at state level or federal level used to be nothing less than 100, few antibiotics and few painkillers. But if we look at the drug list of you know, let's say Abuja Premier Medical Warehouse, which warehouses most of the medications. If we look at the state level, we go to Central Medical Store, we realize we have a lot of new medications. New antibiotics are always coming out. Tobacco drugs, anti-epileptics, you know, are always coming out. That is because research is being done on a daily basis to discover more, you know, and this research is a continuous process through innovation and therapies. So that is one key area, which is also good for the profession of pharmacists. Another area is the academic pharmacy, where teaching, mentorship, and curriculum development for the pharmaceutical research are done in the universities. Now, the specialized emerging fields in pharmacy, you know, we have the public health pharmacy, which is very key and very important. Like I mentioned, disease prevention, vaccination program, you know, population-based healthcare interventions. Let me tell you this, before anybody from a community, when you go to a hospital, look at the data, you realize a lot of people must have visited a pharmacy before they even come to the hospital. What that tells you is how critical, how important it is, because pharmacy is the first point of visitation of the people. They have more access to the people, they have more closeness to the community, and they have the community trust. So it's very important integrating public health services and activities as it relates to HIV care, you know, TB care, malaria, prevention, as well as vaccination program. You know, these are emerging trends. You see a lot of pharmacists now are involving themselves into the public health aspect of healthcare service delivery because they are key and critical in that aspect. And also another key area of the profession is the regulatory pharmacy, drug regulation, policy development, licensing. If we know what NAFDAC is doing, what Pharmacy Council of Nigeria is doing, this is a key aspect. So this is a professional aspect of pharmacy that oversees regulation of the use of drug. It also oversees policies that guide governments and people on how drugs are to be used, what is to be sold, what is not to be sold, what is to be banned by law, what is not to be banned. If you violate these rules as regards to pharmacy practice, what the law needs to do to you, you know, guidelines for establishment of pharmacy, guidelines for establishment of patent medicines. So all these are under regulatory pharmacy. And then we have another key aspect, greatly untapped, very important, is the supply chain and logistics pharmacy. These are emerging trends. The reason why we call them emerging trends is they are new, greatly untapped, things to look into in the future, because the supply chain has actually been, let's say, tapped by non-pharmacists initially. But then later on, we realize you produce a drug, you put it to the market, and before it gets to the market, it gets deteriorated. Why? Because it's being handled by non-professionals. So pharmacists need to be in the supply chain picture from the manufacturing till the end user. And who is the end user? And the patients who take the medication. So the processes of procuring, warehousing, distribution, as well as inventory management, making sure they're being transported in the best temperature, they're being transported clean, no humidity to accelerate the drug deterioration. You know, all these are key professional aspects where pharmacists need to key in and be part of to ensure safety and efficacy. These two words, safety and efficacy of medication. Then we have the nuclear pharmacy, greatly untapped, preparation of and dispensing of radioactive medication, as well as diagnosis in the hospital. And then the pharmacoeconomics, assessment of cost effectiveness and economic impact of drug therapy, like how we assess how drugs are to be produced cheaply, how and which drugs are we supposed to produce in a community to make it more affordable without tampering or without tampering the efficacy of that drug. All these are very important and key because processes are involved, professionality are involved, and a lot of key knowledge of pharmacy profession are involved to ensure pharmacoeconomics is in place. Another thing, which is very recent, digital and AI pharmacy, artificial intelligence and big data, as well as digital health technology in medication management is key. This is greatly untapped, very few people in the profession, because at the moment, you can have digital system that will guide pharmacies as well as pharmacists on the management of the medication, dispensing of the medication, even if areas where there are no pharmacists on the fingertips, they can actually assess the processes they're supposed to follow in dispensing and usage of the medication. Managed by pharmacy is another critical and key area that remains untapped in the profession. So that being said, this brings us to the end of the lecture. However, if we have any questions, feel free to unmute and ask. And if we want to drop it on the chat box, we can do that also as well. Next week, we'll be having another aspect key, that is new drug development. That is what we'll be having. So, but for now, I'll leave us with this. If we have any question, please feel free to ask at the moment. Thank you.
Good evening, sir. Good evening, sir. Good afternoon, sir. Sir, please,
Good afternoon.
Yes, sir, will the questions, the PDF be sent to us? The whole slide.
Sir?
Yes,
the whole
slide be sent to us?
Yes, I'll be sending that.
All right, sir. And also, Are we also going to be having online class like all the times? All the PCP
No, no,
class will
no,
be online.
no. This is my first online class because I didn't want to hold you people back. So it's because I have really something pressing doing
Okay.
that cannot let me. Yeah, but this is my first, and it's not going to be a continuous. So don't worry.
So we'll have physical classes too.
Yes, yes, definitely.
All right, sir. Thank you, sir.
Any other questions? Any other question?
Hello, sir. Sir.
Yes. Yes, I can hear you.
Sir, please, I need more explanation on this digital and AI pharmacy and pharmacoeconomics.
Okay. Okay, so when we say, you know what AI is? AI utilizes big data patterns. AI is artificial intelligence. AI, what we mean by a new profession of pharmacy that utilizes artificial intelligence. This means making the use of drug more safely, you understand, through the use of AI. I will give you an example. Antimicrobial resistance has been a very difficult issue of the recent time. Now, there has been development of AI chatbots as well as digital tools for clinicians to dispense what we call it antimicrobial stewardship, the prudent prescription and dispensing
Sir,
of
your
this medication.
talk is breaking, sir. It's cracking.
Okay, can you hear me now?
Yes, sir, I can hear you, sir.
You can hear me? I think some people.
Yes, sir, I can hear you, sir. I can hear
probably.
you.
Yeah. Yeah. So what I'm saying is AI can be used to improve prudent usage and prescription of medication through having all the prescribing guidelines embedded in a chatbot. All you have to do is, chart the type of medication that you are given, the weight, as well as the type of ailments. So basically, it is making the job of the pharmacist very easy at the fingertip of the community. So making basic prescription easy for non-pharmacists, which we have a lot in the community practicing. And then another key thing is also ensuring even the healthcare professionals prescribe and dispense the medication rightly at the right dose, at the right time, and also making it fast. Initially, we have these guidelines that are bulky that we keep in our pharmacies. We go through them, and ideally, these are bulky things that people don't really patronize. So now with the coming of AI and chatbots, things have actually been easy. Not just that, also in terms of drug management, supply chain, AI plays a key role in tracking medication, ensuring the right person receive the medication. So we get it. We get it. How AI plays a key role as well as digital health plays a key role in improving pharmacy practice. I hope I have answered your questions.
Yes, sir. Yes, sir. Thank you very much.
You're welcome. Any other question, or we can call it a day? Any other question? So by the grace of God, this our next lecture should be physical. I will try as much as I can to make sure it's physical. And we'll be looking at new drug developments. And for this, if I come for the next lecture, if there's any clarification, we can note it down, even though I'll share the video of this lecture, the recording, everything for your review. But when I come physically, we can still come back to this. If there are any questions, we can note it down. I will share the notes with you through your class rep, and I will also share, download the video and share through your class rep. So thank you very much. Have a great day, all.
Thank you very much.
Thank you, sir.
Thank you.
Thank you, sir.
Let's clap for the lecturer.
Yes, sir. You know.
What's happened? Yeah, you connect now. The thing they do. I don't understand. Me, I don't like this lecture.
See me like this.
I dey vex sef.
You should clap for the
Na me
lecturer.
I say back yourself.
Like, can we end the class now? Because you guys are.
No be like the last lecturer.
Yeah, no.
And maybe the program is
Bye, class.
Na shiga uku Zainab.
Because these more people that we have as classmates, they don't want to go anywhere to pass.
I'm hearing results have come out, so. Some of they are saying.
See, as you just said, them I had people. So it was vanilla plant people like people.
Are we not supposed to leave this place?
For everybody go home. Like it's free, you want to show that you.
It's true that that next week there's no class next week.
That is you.
They should have one person just 5.0, but I didn't finish the person for anything. One Riley. Nobody knows who that Riley is.
5 months. Come on, the line.
Admission number is 266. I beg you don't know what I'm saying.
Come on, the line. So you are not too common, you know somebody. No, the person are posted.
As in, she has not taken so she has not said her own, but she knows somebody's own.
That's why you know
She said that the person already she showed the picture of the man to see. That's the man had done it back. You know, this are very. There are things you should play with, there are things you should not play with. Please resort to that one things you don't play. It's not just putting your mouth and say it's a joke. Even if you want to say it's a joke, there's a way you say it jokingly. Don't put people, you don't know what that result is doing to people, you now open your mouth. That is as I did like to very for stupid and frustrating. So people don't slap that thing off. Why we sit down just say results have come out? Somebody was already planning to come back from home. Even now, say by the process, Yunus was about to come back from wherever he was. Okay. Right.
I think they posted
it, but they removed it.
they remove it.
Matthew is done.
They put it in the
They posted it like it's in the faculty and they removed it. But it's Christabel they find for a whole Christabel is in faculty doing what? That girl that little after class she used to go home or she just with boys. It's she they find for faculty. No, sir. This thing, the man was just talking, voice just cracking, nothing I hearing, nobody. People are complaining, he doesn't know what to do, but just sit talking. Only few times the network will come back. As I came here, I think it to be better, maybe it's network issue. You see the DC I'm talking? The faculty DC. Redmi 15C. Boss man.
you see one now going to last season. That is the guy planning to look.
I know.
Yes, for
Yeah. I mean, send them over there. And I don't want to go.